Here he is at the press conference explaining what's going on. Let's go to clip number 1. Go.
Now, where both sides say they agree is that the status quo is not working for the American people. Health insurance is becoming more expensive by the day. Families can't afford it. Businesses can't afford it.
So you want to pass
the federal government can't afford it. Smaller businesses and individuals who don't get coverage at work are squeezed especially hard. And insurance companies freely ration health care based on who's sick and who's healthy, who can pay and who can't. That's the status quo. That's the system we have right now. Democrats and Republicans agree that this is a serious problem for America. And we agree that if we do nothing,
here we go with the agreement again.
If we throw up our hands and walk away, it's a problem that will only grow worse. Nobody disputes that.
No, look. No, not good enough. I've heard this a million times, dude. A million times. Here's what you need to say instead. But then say,
I'm coming for you. I'm coming.
Followed up by,
I'm coming to your house. I'm coming to your house.
Followed up by,
you're going to get it.
Okay, I still haven't heard any of it. Still reaching out, still with the agreement. This guy is pudding soft, man. You know how soft pudding is? You know, you sink your spoon into it. I mean, it's as soft as it gets, right? He's pudding soft. All right, anyway, clip number 2, maybe he gets better.
So the question is, what do we do about it?
Yeah, thank you.
On one end of the spectrum, there are some who suggested scrapping our system of private insurance and replacing it with a government-run healthcare system.
Yeah.
And though many other countries have such a system,
and it works
in America,
excellent.
It would be neither practical nor realistic.
Yeah.
On the other end of the spectrum, there are those, and this includes most Republicans in Congress, who believe the answer is to loosen regulations on the insurance industry, whether it's state consumer protections or minimum standards for the kind of insurance they can sell. The argument is that that will somehow lower costs. I disagree with that approach.
Wow, strong.
I'm concerned that this would only give the insurance industry even freer rein to raise premiums and deny care. So I don't believe we should give government bureaucrats or insurance company bureaucrats more control over health care in America. I believe it's time to give the American people more control over their health care and their health insurance.
You think if you made a pie out of pudding, that it'd be as soft as Obama? Aren't I so moderate? Look at me. I'm going to, tweak the right, but I'm also going to go after the left. I mean, some people think if you did a single payer in this country, that would be the way to go. But obviously that's ridiculous. It wouldn't work here. Really, why? Why wouldn't it work here? It seems to work fine in Medicare. Everybody's happy about that, except that you guys all spent the surplus that it had, okay? But you don't tell the American people that. It works fine in all the other countries, and it works much better in those countries than in our country. I said this yesterday. The Business Roundtable for the CEOs last year came out with a report saying we're paying 2.5 times per capita more for health insurance, 2.5 times than any other developed country. Any other. Oh, yeah, no, single payer is not working out. No. It can't work here. The only reason it can't work here is because you all are up the corporate companies' asses. Okay? Oh, it can't work here because, health insurance companies, et cetera, bought me, and I'm the president, so it can't work here. I say it can't work here. And then making a Republican talking point about government bureaucrats and a takeover over the system. Even if you had single payer, do you know what? I can say this for the millionth time. Going to make me come get him, okay? The government doesn't take over the hospitals. The government doesn't take over the doctors. The government doesn't take over the drug companies. It's only reform for the insurance industry. It's the government doing insurance. That's it. The rest of it is still private. If they did a takeover of the whole system, I wouldn't be in favor of it. Why would I be in favor of it?